Thank you, everyone, for joining us for this important pandemic response update. I also want to acknowledge the fact that I'll be joined momentarily by Bob McDonald, the Executive Director for Denver Public Health and Environment. First, we're going to start with an update of Denver's face covering public health order, which is set to expire on Thursday. Following extensive discussions with our regional partners, as well as current health advice, and the downward trajectory of cases, positivity, and hospitalizations, Denver will not be extending our public health order. So beginning Friday, people will no longer be required under the public health order to wear a mask or show proof of vaccination for entry into a business in Denver. Denver's public health order requiring masks in schools and child care facilities, however, will remain in place for the time being. We simply feel it's important to keep our schools open and our children in class, and being in that classroom is critical to their development. So we want to make sure that they're able to do so safely as possible. Now, please keep in mind, organizations that serve vulnerable populations such as children, our elderly, or those who are ill, and other businesses and venues may decide to continue to require masks or proof of vaccination. They are well within their rights to do so, and we should support them for doing what they feel is necessary to keep people safe and healthy. So I want to be clear and ask the public, please, this is no reason to give their staff a hard time, cause a scene, or inappropriately harass people just because they are enforcing their business requirements. After 2 years of this, it has been incredibly hard 2 years for all of us. We need a little less anger and petulance and a little more understanding for folks towards one another. And so please, let's be peaceful, let's be understanding with each other as we make this transition. We ask you to respect these policies and cooperate with staff if masks or proof of vaccinations are required as you enter. This vaccination, or this virus, is something we're going to have to manage and learn to live with. Let me be clear, this is still a public health emergency and will remain so as long as spikes, surges, and variants threaten to overwhelm our hospitals and our healthcare systems. Denver, from this point forward, will be transitioning into a sustainable management of COVID as a programmatic function of our Department of Public Health. The tool that provides the best protection from COVID, the vaccines and boosters, we all know the word or the phrases, is free and widely and readily available. And that means an effective end to the cycle of mask requirements and capacity restrictions as spikes and surges happen. But listen, we must be very clear and honest and bold about this. The reason there's still uncertainty around this pandemic is because there's still too many people who are unvaccinated, not just those who are ineligible to get vaccines, such as our smallest children, the youngest among us, but people who are making a conscious choice to remain unvaccinated and unprotected. That uncertainty is something we will have to manage going forward. A more targeted and methodical approach to outbreaks will allow us to focus resources without broad restrictions being forced on all residents and businesses in our city. And that's important to understand. I think we're at a very important pivot point in this battle. We're in a much better position than other parts of the country to do this now, because throughout this pandemic, our residents have done what was necessary to slow the spread of COVID. They got vaccinated, they're getting boosted, and they took the precautions seriously for 2 years. Thank you, Denver, and thank you, Metro Denver, and all the state of Colorado. I also want to thank our heroic hospital workers and the thousands of essential frontline and municipal workers who showed up every day to keep our city functioning. our police officers, firefighters, sheriff deputies, paramedics, 911 call takers, the men and women who pick up our trash and plow our streets from snow, and many others. Thank you for keeping this city functioning on a daily basis. We salute you and every one of you. We are grateful for your service. My administration is also doing everything possible to support our businesses and nonprofits, and we'll continue to do so. We've deployed millions of dollars and new programs to help keep their doors open and provide relief to workers and families and help them get through this very difficult time. We supported the distribution and administration of hundreds of thousands of tests and thousands of vaccines to keep our residents safe and healthy, especially those in underserved communities. Thankfully, we've been able to jumpstart an economic recovery sooner than our peer cities, and it's critical now that we keep this momentum going, and we are committed to remaining on the front lines to do just that. In March, the first program supported by funding from President Biden's American Rescue Plan will get underway, and this spring, we plan to issue the first round of bond funding that voters approved in November to help sustain our recovery, create jobs, and build important infrastructure projects. This is a new phase in our response to the pandemic, and we must be diligent as ever to maintain our progress. And so once again, I want to thank the people of Denver. We're at this critical juncture because over 75, almost 75% of us have been vaccinated and are getting boosted and are doing the right thing for the last 2 years, making a difference in our battle against this spread. And so with that, I'm going to turn it over to DDPHE Executive Director, Bob McDonald. Bob?
Thank you, Mayor. Good afternoon, everyone. I'm going to share some slides with you to show you where we are here. Give this just a minute. And there we have it. So I want to start out with, let me back up here. I want to start out with the case counts. And I share this, the epi curve with you, not to necessarily point out the case rate, because the case rate is just one metric of many that we look at in the decisions that we make. I show this to you so that you have an understanding of what's happening. So this case rate here of 588, that is a cumulative case rate over the last week. It's an average per 100,000 over the last week. So that number is actually higher than what we actually, the number of cases that we will actually see today. Okay, so that's because the previous 6 days were higher than this number. So, but you look at the trajectory here, cases are dropping very, very quickly. It's the same thing with positivity rate. So you look at the 7-day positivity rate, that's going to be higher than what is actually happening today. But probably more important, and what really drove the decision in terms of lifting the face covering order, is what the modeling indicates. Now, you might recall 2 months ago, it was very clear that the modeling indicated that if we did not do something to reduce transmission, that hospital capacity would be breached in mid to late December, and that did not happen. That did not happen. So our face covering order was absolutely successful. Hospitals were not breached, and hospital admissions continues to decline, and it's been declining over the last 2 weeks. The other thing that the modeling clearly indicates is that lifting the face covering order today will have little to no effect on this trajectory here. Modeling makes it very clear that lifting the face covering order now is safe. Cases are going to continue to decline. And what that says is that Omicron has run out of fuel within our community. It's safe now to lift our face covering. Still be diligent. If you have not been vaccinated, please get vaccinated. If you're immune compromised, you're struggling with health issues, then continue to wear those face coverings. Get vaccinated. Give some thought as to whether or not you convene in large settings where there might be others who are not vaccinated. So, as the mayor said, our current face covering or vaccine passport system, there's an option there. There has been under the current order. Will expire on February 4th, and we will not renew it at this time. Face coverings are still required in schools and childcare settings, and we're having those conversations now as to when the appropriate time is to lift that portion of our mandate. But I want to be clear, we're not going from mandates to nothing. We are still strongly encouraging testing when appropriate, face coverings, get vaccinated, get boosted. I'll show you some data here on really what the difference that the vaccine makes. So continue to use these tools. These tools are now readily available. You can get vaccinated. It's much easier now more than it has been during the entire pandemic to get access to vaccines. Access to face coverings is widely available, and then also testing. So everyone has the tools now that they need to make educated decisions. We're still here to answer questions, to provide guidance. So reach out with questions if you have them. But I can't stress this enough. The best protection you can get is to get vaccinated. Take a look at this data here. This is not Bob McDonald's data, all right? This is not the mayor's data. This is national data from the Centers for Disease Control. So this is what is seen across the country. And it's very clear that the people those that are getting hospitalized because of this are largely unvaccinated people. You see the difference between getting vaccinated and unvaccinated people, and even more so if you get boosted. That's about as much protection as you can get. So please get vaccinated. And with that, I'll stop there and turn it back over to you, Mayor, for questions.
Thank you, Bob. We'll go ahead and turn it back to Teresa for Q&A. But let me say, I want to make a correction. I said 75% of us have been fully vaccinated in Denver. We're at 78% as of this morning. And I think that is phenomenal, which allows us to do what Bob talked about. So this decision to not extend the order is based on science, and it's based on the people of Denver doing what they needed to do to help reduce the risk to all of us. So let's go ahead and do question and answer, Teresa.
All right, Mayor, thank you. And when I call on you, if you have a question for the mayor or for Bob McDonald, you can unmute yourselves and just state your name and where you're from. John, Axios.
Yeah.
Might have to star 6 to unmute, John. We'll try.
This is John Frank at Axios. Sorry about that.
That's okay. Go ahead.
Mayor and Director McDonald, can you talk a little bit about the timing of this now, just as we're starting to see Omicron .2, run rampant across the country? I understand that it's not huge yet here in Colorado, but is there any concern that this might be premature? Thank you.
Bob?
Great question. I'm glad you asked it, because we work very closely with our partners at the State Health Department and also the School of Public Health on that modeling that I spoke to earlier. And right now, modeling suggests that while there is a subvariant of Omicron, the tools that we keep reinforcing are the same tools that are going to protect us from this subvariant. And it's also, the modeling also indicates that we will not see the surge like we just saw with Omicron 1. We are not going to see that. There's large protection through natural immunity and vaccines. So I don't think it's too premature to do it at this point. This is very thoughtful. And again, modeling indicates that lifting the face covering order right now will have little change on the downward trend of cases.
Thanks, John. Esteban.
Hi, Mayor, Bob. Is the city kind of changing its approach a little bit? Is it treating COVID as an endemic at this point? Can you talk a little bit about that?
I'll follow you, Bob.
Well, it's a great question, and I would suggest that this idea of something being endemic is really a concept. It's not a day that happens. It's not a vaccine percentage at which that happens. It's really that point in which a virus, or in this case, the Omicron variant, starts to slow down and diminishes just because there's no more fuel left. There's nobody left to infect because so many people have had it, or the vaccine is holding up for many, many people. And so I think that, what we're seeing here is a variant with Omicron that is more infectious, but less severe. And when you see that kind of change over time, that can be a sign that we're moving towards something that is endemic, because as a reminder, coronaviruses are not new. We've all had them. We've all struggled with them throughout our life. Those and adenoviruses and rhinoviruses. Those are all the things that give us respiratory problems throughout our life. The fact that Omicron was less severe and more infectious might be an indication that it's moving towards something very similar to other coronaviruses. I think it's a little too early to make that determination, but I think we are moving towards that space where this is handled more programmatically.
I let Esteban, Bob answer first, obviously from a public health standpoint and the data that leads us. And that's, it's been leading us for 2 years. But you might recall a year ago, being at 70% vaccinated, fully vaccinated, was a dream for us. This is where we wanted to be, where we could see the end of the tunnel, if you will, with this virus. At 78%, people of Denver have done exceedingly well in terms of doing what's necessary for us all to protect ourselves. The fact that many of us have also contracted the virus and with the vaccinations had mild or at least manageable symptoms, that to me demonstrates, at least from a non-scientific point of view, in my mind, that we're beginning to cross that bridge that says that now this is a manageable, or at least a situation we have to manage on a regular basis, as opposed to issue these very challenging orders at times. So I'm optimistic, but I'll continue to follow the data and follow the advice of our public health experts.
All right, thank you, Esteban. Let's go to Matt, 9 News.
Thanks, Teresa. Mr. Mayor, it was only about a week or so ago that the city announced that you would be distributing the N95 masks. Are you concerned that there's some perhaps mixed messaging in that it was only a week ago that you were distributing the best masks available and now dropping the mask mandate?
No, absolutely. I don't think it's mixed messaging. I think it's an acknowledgement of the tremendous effort that people of Denver have undertaken to get control of the spread of this very transmissible variant of the COVID virus, and really the proper steps necessary to give people the ability to manage on their own how they want to decide in terms of whether they wear the mask. Nothing keeps people from putting those masks on and continue to wear them in and out. I'm about as tired of masks as most people I've talked to, but I expect there'll be times where I will throw my mask on because just a sense of comfort until we feel like we're fully out of this thing. So, this just goes to, we're all in this thing together, and we get to make this decision on whether or not we wear these masks at this point in time. And I think the modeling, the science tells us it's okay to do this. And I think that's the important thing. This is not an arbitrary decision of Bob McDonald or Mayor Hancock. This is saying the data tells us, the modeling tells us it's okay to drop the mask come Friday.
And Matt, too, just a point of clarification, too, those masks are being provided by the state, and Denver's one of many municipalities supporting the state in that distribution. So, John Daly, you're next.
Great, thank you. Thanks for taking our questions. John Daly with CPR News. I'm wondering if we were to have another variant that was like Delta, was like Omicron, would you anticipate potentially having to go back to these measures once more at some point? We've had 2 bad waves, both in the winter months now through this pandemic. So I guess that's A, and then B, what metrics or how would you decide if we at some point did need to, return to some tougher restrictions once more?
Yeah, I'll allow Bob to answer a question, but I'll say this again, and we said this at the onset. We're going to let data lead us where we go on this, and good apolitical decisions based on public health, science, and data. And so, when we say that the modeling and the science tells us that we can drop the mask and not extend the order that we're currently under the vax or mask order, we're following the guidance and we're following the numbers, and we'll continue to do that which means that if there was a major spike that threatened the public health of our residents, then we will make decisions accordingly with that. Bob?
Yeah, thanks, Mayor. Before I answer that question, I just want to go back a moment and talk about the school mask mandate, because to be quite honest here, I'm getting some feedback already that why would we not lift that when we lift the broader public health mandate? It's important to understand that not everybody in the school age group can be vaccinated. So that's one thing. But the other thing that is somewhat outside of the data world is state policy. And so we have to be careful. The goal here is to keep kids in school. And under current state guidelines and policy, if we lift that and there are outbreaks, those kids may have to quarantine. Having them in face coverings, they are treated as if they are not a close contact because they are wearing face coverings. So, we have to be a little bit more thoughtful here than just looking at the data. We have to look at state guidelines and policy. And if we lift that mask mandate for school systems, it's possible that kids could be taken out of school. Regarding, what the future might look like, I think the mayor was spot on. We'll do what we need to do to protect the citizens of Denver. I think the mayor's demonstrated leadership in that, you might recall, in the early days of the pandemic, he authorized the first stay-at-home order in the state. He authorized the first face covering order in the state. He authorized the first vaccine mandate in the state. So I think it's clear that the mayor and the administration will do what we need to do to protect the citizens of Denver. My hope is that we don't have to go back to mandates in the fall, and we can manage this with some of those more programmatic tools.
Thank you, Bob. Let's go to Seth from the Gazette. Seth?
Thanks.
Uh-oh.
We lost you, Seth. Try again.
Guys hear me?
I think we've got you now.
Sorry, can you guys hear me?
Yes.
Yep, sorry. Mayor and Bob, you both have mentioned sort of managing it programmatically. Can you talk about what that's going to mean practically? What will that look like going forward, until we hit some sort of wave, if that happens in the future? Thanks.
Yeah. Bob?
Yeah, well, I think a number of things would have to happen, and I think we are very much headed in that direction. I think long-term, we have to have enough people that keep up with booster shots, just like we do with other types of respiratory illnesses. We're always promoting, get that flu vaccine, right? Because enough people get that, then we keep from overloading hospitals. So keeping up with COVID-19 shots over time is one thing. The second thing that has to happen for those that, for whatever reason, continue to resist a proven vaccine and a safe vaccine, for those that continue to make the decision not to get vaccinated, we have to have easy access to pharmaceuticals. Those are coming online. So booster shots, easy access to pharmaceuticals for those who continue to make the decision not to get vaccinated. And then our hospital systems, they're stable and hospital admissions are going down. But we still want to be in a better place than we are today, and hospitals are recovering. Those are some of the things that I think keep us in that space where we can handle this more as an endemic virus.
Lisa?
Thank you. Let's go to Jessica of the Denver Post.
Hi, I want to clarify, you said that you were in discussions regarding masks in schools. Is there an expectation that that could be lifted before the end of the school year?
Well,
go ahead, Bob.
Mayor, do you want me to take that?
Yes, go ahead.
Okay. I don't think there's any expectations here. Again, we're going to be driven by science and data, but to the earlier point that I made, there are state level policies that indicate that if there is an outbreak in a school setting, under current guidelines from the state, we could have large groups of kids quarantining. And so, we have to be a little bit more thoughtful than just, in a public setting, we don't have that challenge. In a school setting, we do have to be thoughtful about that because we could wind up quarantining a lot of kids if we left that face covering. So we're going to look at data. We're going to talk with our regional partners. We're going to talk with our school partners and our state level partners. And we're going to make the right decision when it's the right time. But we're having those conversations now. But I wouldn't be in a position at this point to say it'll be lifted in the next week or the next month. We want to be thoughtful about it.
Thanks, Jessica. Vinny from Bloomberg. Hi, Vinny, are you there still? All right, I don't hear Vinny, but if you do have a question, jump in, Vinny. We'll give you another opportunity. Let's go to Alex, Fox 31.
Can you hear me now?
Oh, we got you.
Teresa?
Yep, I got you, Vinny. Now I can hear you. Go ahead.
That's what happens when you try doing this on a payphone. Okay. Mayor, sorry. You say this is still a public health emergency. Can you go into that a little bit more? I guess there's some obvious things like this, the kids' mask mandate. What other things are you leaving in place that leave this as a health emergency?
As Bob pointed out, Vinny, you still have to, public transportation still requires for you to wear a mask, RTD, rideshare. Of course, the airport is under federal regulations in terms of these sort of things. You'll still be required to wear a mask at the airport. And of course, the schools, I think, is an important piece. Obviously, we also strongly, we will leave in place working in elderly care and where other vulnerable populations exist. So that kind of continues to demonstrate that these are still, this virus is still with us. We're going to have to manage it. But for people with particularly vulnerable, who are particularly vulnerable or have maybe compromised, could be compromised immune systems, not as strong as some others or most people, we're going to have to keep the mask or vax order in place, or at least the masking order in place for these facilities. So that gives you an indication that we're still going to be dealing with this and we're going to have to manage it and that this is still an emergency. But for the general public as a whole, numbers and science tells us that we can drop this mask as Bob has pointed out.
Would you venture to guess when the emergency might wind down and what you're looking for where you would feel comfortable making that declaration? Thank you very much.
No. Simply put, no. And a lot of the regulations that I just acknowledged are under state control, such as the elderly care facilities are an example. Hospitals would be under CDPHE. So I would never guess, not with this variant, not with this virus, I should say. And Bob may want to volunteer something, but nothing suggests to me that we will do any good trying to guess to the public when we're done with this. Whenever I thought we were done, I never thought this would be 2 years later we'd be dealing with this. When we shut down the city in March, I thought, well before summer, we would be back open and fully operating. But here we are 2 years later. So no guessing on my part, and I would not do that to the public.
Bob, anything to add?
No, I think the mayor nailed it. I'm not guessing either. That is not what serves us well through a pandemic. So we're going to be thoughtful, data driven, and talk with partners and make regional decisions and have alignment. But I don't want to get in the habit of guessing what will happen in the future. I think we need to leave all doors open.
All right, thanks, Bob. Alex, now you're up.
Thank you so much. When this indoor mask mandate was first announced late last year, you had members of Jefferson County Public Health and other regional partners a part of this announcement. Why aren't we seeing the same collaborative announcement now that the mandate is being rescinded here in Denver? Thank you.
Bob?
Yeah, I'm going to ask that question too. Just because they are not with us this afternoon doesn't mean that we are not very much aligned with the direction in which we're heading. I don't want to get ahead of my partners at the Tri-County Health Department in Jefferson County and others, but we talk almost every day. We communicate almost every day about data, about the direction that we should be heading. And so, but those counties will make their announcements when they feel it's the time to do that. But make no mistake, we are in very close communication regionally.
Thank you, Bob. I've gone through everyone who was initially on my list. Anyone else from the press on the line who did not get to ask a question? All right, hearing none. Thank you so much for being with us. Mayor, any last closing words?
Yeah, no, thank you, everyone. And Bob, thank you as well, Teresa and the team. And again, to the media, let's allow the work and efforts of our frontline workers and our first responders who really help carry the load and get us through this, and the people of Denver, of course. Thank you all.
Thank you, Mayor, and thank you all for being here.
Thank you.